Vaginismus affects a lot of women in my practice. It is defined as the vaginal muscles going into a protective spasm, often after some sort of trauma, a stress, big breakup, big life change, new school, move, divorce. So many different things can cause the vaginal muscles to go into a protective spasm. Basically, what happens is your muscles just, guard to protect against whatever it was that felt threatening in your life. Oftentimes, vaginismus is accompanied by extremely painful penetration during sexual intercourse, painful insertion of a tampon, painful insertion of a finger, sometimes to a debilitating degree where we cannot even insert a tampon. We cannot have penetrative intercourse. The muscles are that tight and restrictive. They can also be so restrictive that we can't get our doctors to examine us during a pap test. A gynecologist can't fit any tools inside because it is so tight and painful. How can pelvic floor physiotherapy help with vaginismus? Well, I take a very holistic, multifaceted approach when I treat vaginismus. First thing I'll do is I'll start with some education. I'll talk to my patient about how this is not your fault, this happens, and here are things you can do at home to help. We'll talk about how to slowly start reducing stress in your life. We'll talk about how to start bringing in a little bit more positive reassurance that this is something that can be treated. We'll talk about how to talk to your partner who may be also getting a little bit frustrated at the difficulties during sexual intercourse. In clinic, we'll do a lot of hands-on therapy. I will talk to you about dilation work that you can do at home. Very gradual, increased dilation as you start to get those muscles stretchier and more flexible throughout the day. We will also do some hands-on therapy for the pelvic floor itself, stretching out any tight or restricted muscles that often accompany vaginismus. I often offer abdominal massage as a very comforting, soothing treatment that indirectly helps with the connective tissue of the pelvic floor. And I will always offer acupuncture. It's not mandatory, but it is lovely, and a lot of my clients love it for wonderful pain relief as well as increased blood flow.